Hey, it's Dr. Tassone. It is, what is it? It's Thursday. It's January 23rd. And I just wanted to pop on here and talk about anything you wanted to talk about. Do you have any questions, any comments? We can talk about, there's a couple of things I'd like to talk about. One being hormones. Sound like a broken record, but I do like talking about hormones. As a matter of fact, currently, I have one slot left for my premium hormone package online, which includes 2 visits, and if you get it now, it comes with a free Dutch test. So if you go to tassonemd.com/one-on-one consultations and you buy the premium package, it used to be a $9.97 price. Now it's reduced by 25%, and that gets you a free Dutch test. So if you've ever wanted to do a Dutch test, get your buns over to my website and buy the premium hormone package. You'll get a free Dutch test, and you'll get me interpreting it for you and seeing where we go from there. Did I mention it's a free Dutch test? That's like a $350 value. What am I thinking? I don't know. Anyways, tassonemd.com/one-on-one consultations. Go to the premium hormone package, 25% off, basically gives you a free Dutch test. So go get you some. So let's talk about hormones, because the number one thing I'm seeing in the clinic is, that's a good thing. Yeah, thanks, Brandy. That's a good idea. What the hell is a Dutch test? So there's 2 ways to check hormones that I think are legit. One is blood, and one is a Dutch test. Blood is very accurate. It goes through your insurance, so it's usually covered. It checks all the hormones and thyroid. It checks vitamin D. Blood is very accurate, but it's only accurate while the needle's in your arm, and it's a little bit painful. The Dutch test is a 24-hour urine test that gives you not just all the sex hormones, it gives you breakdown pathways so I can tell how you're detoxifying your estrogens, how you detoxify your testosterone. It tells me something super important about your cortisol, which is massive. It tells me vitamin B6, B12, dopamine, norepinephrine. It tells me about your oxidative stress in your body. So the Dutch test gives me more information, gives me more of your story, as it were, but it's 24 hours rather than just a snapshot like blood is. So, and it's also extremely accurate. The only thing that the Dutch is limited by is thyroid and vitamin D. But here's the deal: if you buy that premium hormone package from me and you want to get the free Dutch test, we also can order blood. So I not only get the Dutch test cooking, because the Dutch takes about 3 weeks to come back, but we get the blood results right away, so I can start working on things for you real quickly. If you're already an office patient and you are using insurance, I can't extend you this deal because you're already using insurance. This is just for patients mainly that don't want to use their insurance, because I can't be on contract with an insurance company and charge cash at the same time. So if you're already an established patient, I can't extend this to you, unfortunately. But yeah, you don't need a Dutch test, Brandy. The blood is extremely fine. It's completely accurate. It's going to do the job. It's just some folks really want to go a little bit deeper, and they want to know more about their cortisol. They want to know a little bit more about their detox pathways. But there are a lot of women out there that would like to try a Dutch test. They've heard about it. They've thought about it. They just didn't want to pay the $350, and this is a chance to do it. So let's talk about the number one hormone imbalance that I'm seeing in the office. So first of all, if you take my quiz on tassonemd.com/quiz, you go take my quiz, you're going to find out what your hormonal archetype is. And that's basically what's your story based on how you answer the questions. And the number one thing that I'm seeing far and away is testosterone deficiency, or what I like to call the NUN, N-U-N, but I jokingly say that's because you don't want none, and you most likely aren't getting none, and neither is he. But that's extremely common in all age groups, all categories. And it's due to a lot of things. Birth control pills suppress your testosterone. You're busy, you're working hard. I jokingly tell men all the time, if they come to the office, do the dishes. Don't kiss her neck, go do the dishes. So, there's lots of things that go into that, but that's the number one thing I'm seeing far and away, followed second by estrogen dominance, which is the story that I call the queen. And these stories, there's 12 of them. There's 12 archetypes, 12 storylines, can change from, year to year or month to month. It's just one of those things that you can go take the quiz and find out what your storyline is. And then you can also sign up. It's extremely accurate, the quiz. I've had a lot of women email me and write me back saying it totally described them. You'll get a quick storyline right after you take the quiz. You'll get an email back saying what you are, and it'll give you about a page of your story that will describe you. So, but testosterone deficiency is amazing because there's so many testosterone replacements for men right now on the market. There's about 10, and there's 0 FDA-approved testosterone therapies for women. Actually, 0. That means like none. So we have to compound it. As you are aware, I hate pellets. I'm going to tell a story, not today, but I'm going to tell a story probably next week about pellets that's going to reinforce my belief as to why I don't like pellets. I've been thinking about sharing it, but I have to figure out how I want to tell it. But pellets I don't like. They're painful. They get infected. They can't control your hormone levels. They get too high. They are too expensive. And for women, it's not a good way to go. I've seen so many women have complications from pellets that it's just, I can't even believe people put them in. But anyways, that aside. So hormone replacement, if you're in Texas or in Austin and you want to make an appointment, Maddie can give you the phone number. It's 512-956-0296. You can call. I take all the insurance plans. If you're a cash pay, you can go to www.tassonemd.com/one-on-one consultations, and that's where you can pay for the premium hormone package if you want to do that, which includes visits with me and a free Dutch test. So imagine that, free Dutch test, which means I'm basically paying for the Dutch test for you, which is good, but I just want women to have access to it and to try it. I need to shave. I haven't shaved. There's a lot of beard going on there. So any questions out there right now about hormones, please feel free to chime in. If you're watching this not live and you have a question, please ask. We'll come back and answer it for you. I just did some Essure surgeries today. I'm in a couple of state Essure pages, I think Illinois, Pennsylvania, and a couple of others, Georgia and some others. And I'm still amazed at the women that are just getting mistreated. While there are some doctors that are coming around to it and they're starting to take them out and they're being as helpful as they can, I still think there's a lot of women that are getting mistreated. They're not getting x-rays done. They're not getting the proper surgery done, and they're leaving fragments behind. I have women calling all the time with fragments being left behind. Brandy asked, if I take out ovaries, will I need the package you're about to talk about? If you take your ovaries, Brandy, you don't need a package. You just can keep seeing me for your hormones, and we can use your insurance like we have been. That's not a problem. And it depends on age and all those other things too. But if you're already seeing me, Brandy, which I believe we've already had 1 or 2 visits, then don't worry about it. We got you handled. You're already in the system. You're covered. These are for patients that haven't seen me yet. So, Essure removal, there's 2 options, hysterectomy. And if doctors want to do hysterectomy, that's fine. Any gynecologist can do a hysterectomy. It's not an issue. They all know how to do it. Make sure it's probably laparoscopic and not just a straight vaginal hysterectomy, because there's really no way for them to see the entire fallopian tube. If they're going to do a salpingectomy or a hysterectomy, make sure they do an x-ray before the surgery so they know how many coils you have and where they are in your body. If you're doing a salpingectomy, make sure they do an x-ray during the surgery before they wake you up to make sure they actually got the coils out. Easy as that. One of the things I see with hormone imbalance, especially estrogen dominance, is fibroids. A lot of women have fibroids. We think about 80% of the female population has fibroids. Fibroids are little muscular knots that occur inside the uterus. They can be anywhere from pea size to, I've seen one as big as a basketball. They cause pain, pressure, bleeding. It used to be that we would treat these with either a myomectomy or a hysterectomy, where we would cut the uterus or take the uterus out. There's a new procedure out now called Accessa, which is an outpatient surgery where I actually put a needle inside the fibroid and it heats up from the inside, basically melting the fibroid from the inside out. Very non-invasive and gives you another option if you don't want to lose your uterus, which many women, especially here in Austin, really don't want to lose their uterus. So you do have another option. So if you have the ability to get to Austin, come see me for fibroids. So if you have any questions, feel free. If you have any issues with hormones, drop me a line. Like I said, if you live in the Austin area and you want to see me in the office, just make an appointment, 512-956-0296. If Maddie's on, can you please put these up, Maddie? I need the link for the premium hormone package. If you live outside of Austin and you can't get here and you don't want to use insurance and you'd rather pay cash, which I know sounds weird, but actually it's pretty cheap, I'm going to give you, we can still order your blood through your insurance, but we'll also throw in a free Dutch test, which is a $350 value. And that will give you a lot more information. So we'll kind of get the 1-2. We'll get the blood going, get an immediate result, get you started on something, but then we'll back it up with the Dutch, because the Dutch is going to tell me your estrogen detoxification pathways amongst cortisol and all these other things. So the other thing I wanted to say is my new tagline is, a lot of you ladies have gone to other doctors. You don't feel right. You feel miserable. You've gained some weight. You're not sleeping good. You're on edge. You're having irregular periods, and they've drawn your hormones, and they've told you that you're normal or you're just getting older. First of all, that's ridiculous, and I want you to remember this line. Normal isn't normal if you feel hormonal. That's just the way it is. If you feel like you are having a problem, if you feel like you know your body better than anybody, if you feel like you're having an issue and somebody tells you that your hormones are normal, go see someone else, because that doesn't jive, right? You know that you don't feel right. So you need to go see somebody that actually can look not just at the numbers. The numbers are a range, right? So what if you're in the 10th percentile? Well, maybe you'd feel better in the 75th percentile. Still normal, but maybe you would feel better personally. I can't tell you how many times that I've had that happen where women have come in, their labs are technically normal, but we bump them up a little bit and they feel a heck of a lot better. So don't take no for an answer. Don't take normal for an answer if you don't feel normal. I honestly feel that's BS. I mean, if a guy goes into a doctor's office and tells him he doesn't feel right, the doctor's not going to say, oh, Jeff, you're just getting older. That's BS, but we do it to women all the time. So ask questions. If you have any, call the office if you want to make an appointment physically. If you want to get in on this free Dutch test, I have one left, but I can probably stretch it out to a couple more. But I'm not trying to create FOMO. I don't want to go out of business. But they are. It's a $350 deal, so get in on it while the getting's good. Go ahead and ask questions if you have any. Otherwise, I'm gonna get off here. I got to go pick up my son at school in about 30 minutes. So, but I just wanted to pop in today and talk about the hormone giveaway. If you have questions about Essure, feel free to email me anytime. I have women traveling from around the country. It's literally one visit to see me. We do everything else on the phone. We'll pre-op. We'll get your insurance. I take all insurance plans. The only insurance plan that we can't do is Medicaid outside of Texas, because Medicaid is state specific. So you have to be in the state that you live. You have to see a doctor that practices there. Otherwise, I'd love to do it. There is no such thing as hormonal, my trademark. Well, what would you call it then? Well, here's the deal with that. So what we do, I can remember when I was a kid, I was probably 15 or 16, and my mom was yelling at me about something. And I'm sure she was yelling at me because she was having a problem. It wasn't probably me, I'm sure. But she'd had a hysterectomy, and I was only 15 or so, and I asked her when the last time was she took her pill. Because even at a young age, 35 years ago, I knew that women's hormones were a problem. Now, I'm saying that because I think it's ridiculous. We blame everything on women's hormones, so I totally get it. It's not all hormonal, obviously. Sometimes I say, I always ask patients sometimes, do you feel like you want to choke someone out? And they say yes. And I'm like, well, sometimes people just need to be choked out too, and they're being jerks. So that's okay. That doesn't mean that you're being hormonal. Hornormal. That could actually sound bad, Amy. So I'm not going to say that. Jen Peters, is that the Jen Peters urologist from Tucson, Arizona? My goodness, I haven't seen your name in a long time. Jen Peters, a wonderful urologist there in Tucson, Arizona. And she, when we moved here to Austin, was kind enough to take our dog, Bodhi, who is a Shiba Inu, and he was a good guy, but he didn't seem to like children very much, and we had young kids. So he stayed with old Jen Peters and out there in Tucson, and she sent us pictures, I think, about a year ago to show us what he looked like. And so it's good seeing your name again, Jen. So any other questions? Anything else I can answer for you? Remember, TassoneMD.com/one-on-one consultations. If you go now, you'll get the premium package, gets you a free Dutch test. I mean, unreal. This was not my idea. It was Maddie's idea. And I'm just going to have to take it out of her salary. But no, it's good. It's good because you can try the Dutch if you've been wanting to try the Dutch test. So if you want to talk about getting a Dutch done, you can always ask a question. If you have questions, I'm going to head off because I got to go pick up my son from school. But I hope you're having a good Thursday.